Hello there. It is my pleasure to provide you some practical information to help you through your upcoming parotid surgery. It is completely normal to feel nervous about the unknown. Together, we'll explore how to best prepare, what to expect, as well as the best way to become involved in your recovery of your upcoming surgery. All information presented is recommended and supported by a critical review of the medical literature, including the recent recovery pathway called ERAS, standing for Enhanced Recovery After Surgery. When compared with traditional operative care, using aspects of ERAS has been associated with decreased pain and length of stay, while simultaneously improving patient satisfaction and quality of life, thus enabling you to recover more quickly and resume routine activities in a more timely fashion compared to standard surgical care. Benefits have been reported for patients undergoing head and neck procedures. Please keep in mind that this guide is meant to be a general overview of the type of surgery you may be having. The details and extent of your surgery will vary per patient and depends on the particular cause for your type of surgery. A surgery is something that is best approached when one is prepared and takes the appropriate measures to recover from such a physically and mentally draining day. You should spend the time before the procedure being as active as you can, whether that involves going for short walks or exercising, having a well-balanced diet, and getting appropriate amount of sleep. If you smoke or drink alcohol, you'd benefit to stop as soon as possible because smoking can cause problems with breathing, wound healing, and overall recovery from surgery, and stopping alcohol consumption reduces post-operative complication rates. Although this may vary depending on your healthcare team, ERAS recommends taking the following steps before your surgery. The recommended pathway allows consumption of solid foods up to 6 hours prior to surgery and clear liquids up to 3 hours prior. You can drink clear liquids such as water, black tea, black coffee, or apple juice, but no liquids such as milk or orange juice are allowed. Before surgery, patients should shower or bathe, full body, in 4% chlorhexidine gluconate soap at least the night before, and ideally also the morning of the operative day, as it has been associated with a lower risk of surgical site infections for patients undergoing head and neck surgeries. Hair in the operative field should be clipped, not shaved, while skin is clean to avoid any cuts or irritation. The day of the surgery. Try to bring a family member, friend, or someone to assist you. You won't be allowed to drive after outpatient surgery or even after a few days in the hospital, primarily if you're taking pain medication. Plan to have someone take you home. Wear comfortable clothing. Wear or bring loose-fitting clothing. Your body might be sore or swollen from surgery, or you may have bulky bandages over your incisions. Leave jewelry and valuables at home. You can bring toothpaste, a toothbrush, pajamas, denture cup if necessary, and any medications that you take regularly in a labeled pharmacy container approved by your healthcare provider. You may also choose to bring compression stockings to wear on your journey home. On the day of the surgery, the healthcare provider who will admit you will likely check your temperature, blood pressure, pulse, and breathing, review your medications, and help you get ready. You will receive some medications before and after surgery to improve pain control. Frequently, an intravenous tube, called an IV, will be placed into a vein in your arm to allow you to get fluids and medication. When you are ready, someone will help you onto a stretcher and take you to the holding area and then to the operating room. During your hospital stay, criteria for discharge for any patient undergoing parotid surgery include tolerance of their diet, ambulation, ability to go to the bathroom, and appropriate pain control. This may mean that you can be discharged home the same day of the surgery or the morning after, depending on the specific type of surgery you had and your recovery process. Diet. It is important to note that your throat may feel sore from the tube used to help you breathe during the surgery. This is completely normal and will pass after 2 to 3 days. After the surgery, you'll be permitted to start drinking and eating again. Start with small sips of water and slowly progress to soft foods and then a normal diet as tolerated. Mobilization. By a few hours after your surgery, you should be able to get out of bed and walk around before being ready to be discharged home. If you feel faint or dizzy, call the nurse to help you get back to bed. Post-hospital recovery. Your wound. During the operation, the skin over the face is lifted and some superficial nerves are cut. This means that the skin over the incision, the area in front of the ear, and the earlobe itself may become numb for some time after the surgery. Normally, the sensation returns after several weeks as the nerves regenerate over the area. It is important to note that a very important nerve, called the facial nerve, passes through the parotid gland. This nerve allows movement of the face. In majority of cases, this nerve works perfectly after surgery. Damage or bruising of this nerve can lead to facial weakness, also called facial palsy, which will likely recover over several weeks and may require exercises suggested by a speech-language pathologist. In cases where the nerve may be involved with a malignant tumor, the nerve may need to be cut in order to remove the tumor safely. If this is the case, your surgeons will discuss the details prior to your surgery. Incisions over the neck for a parotid surgery are typically closed with sutures that are placed strategically under the skin to minimize scars. Your surgeon will likely cover the incision with small steri strips. If they are non-resorbable sutures, they will be removed by your doctor 1 week after the surgery. Otherwise, your healthcare team will inform you that they are dissolvable and no suture removal will be necessary. You may help further reduce scars by placing polysporin or vitamin E ointment and massaging the incision 3 to 4 times a day after your first follow-up appointment. It is important to avoid sunlight and tanning for several weeks to months after your surgery, as UV rays during the healing process can make the scar more permanent and noticeable. It is not unusual to suffer pains around your surgical sites during the first week following surgery. You will be given pain medication in order to help, and the pain will slowly pass after several days. Showers. It is important to keep your neck dry for at least 72 hours after the surgery, which means you may start to take showers 3 days after the surgery. Let the water run over your wounds and do not rub them, only pat them dry. Please contact a healthcare provider if your wounds become inflamed, painful, swollen, or start to discharge fluid. Diet. You will have no diet restrictions once you are discharged home after surgery. You may want to stick to a softer diet for the day of the surgery if you feel that your throat feels sore. However, most patients are comfortable going back to their regular diet the day after surgery. Exercise. It is important to note that no exercise or heavy lifting is allowed for 3 weeks after your surgery. Avoid running, biking, swimming, or lifting anything heavier than a laptop or a phone book. Walking is usually encouraged starting the day following your operation. You should plan to undertake regular exercise and gradually increase this during the 4 weeks following your operation until you're back to your normal level of activity. Common sense will guide your exercise and rehabilitation. In general, if the wound is still uncomfortable, modify your exercise. Once the wounds have completely healed, you can normally undertake most activities. Driving. You should not drive until you're confident that you can drive safely. It is important that any pain has resolved sufficiently, that you're able to completely mobilize your neck in order to look behind you in both directions, and that you are not taking any medication that would interfere with your ability to react appropriately in the event of an emergency on the road. For most patients, driving is usually safe 48 hours after their surgery. Hobbies and activities. You should consider taking up your hobbies and activities as soon as possible again after surgery. This enables you to maintain your activity and will benefit your recovery. You should not need to restrict these unless they cause significant pain or involve heavy lifting. Tiredness. It is frequent to feel low energy levels following surgery and anesthesia. It is important to mix activities with some rest as needed, and appropriate return to work can be discussed with your healthcare team before or after your surgery. In summary, to enhance your recovery, you will benefit to return gradually to normal as quickly as possible. This means that you need to actively participate in your recovery by walking, eating, and drinking. Each day, you should feel some improvement, but do ask your healthcare provider if you're worried about something. You can refer to the list of products on precare.ca for your specific surgery as an example on what you need for your surgical preparation and recovery. It is our hope that this video makes you feel more confident about what's ahead. On behalf of the Precare team, We wish you the best on your journey.